So if a parent has been tested for that and they do not have it, and let's say even both parents have been tested and they do not have that, does that mean it's guaranteed that their offspring do not have that?
It is not guaranteed. My comment is, in medicine, nothing is 100%. Okay? So the thing is, all of the mutations are not known yet. Okay? However, I think that if both parents are in fact negative, if they are tested, cancer can still develop, as you know. Because one of the risk factors in general, especially in women, is age.
Is there a specific zip code or area code that you can target or a relative cancer to?
Now, what you may be asking is, how available are mammograms to those individuals who live in certain areas? That is access. There is the Wisconsin Well Women's program that is available to certain individuals economically, wherein they can, if they qualify, from their economics, they can have mammogram and cervical cancer screening. And those things are available here and now. So it's a matter of sometimes picking up the phone and just calling the state Department of Health and Human Services, and they can tell you locally where a center is if you want to get a mammogram and you can't afford to, otherwise you don't have insurance to do so.
Or a woman with a strong history of breast cancer, family history, and who tests positive for the gene, what is your recommendation as far as preventive mastectomies go, or do you take a wait-and-see attitude?
What we do in a case like that is that we have the discussion about the options that are available to that particular individual. The options are surveillance, as you mentioned, and which is a wait-and-see approach. And with that surveillance, there should be a regular schedule of mammograms, clinical breast examinations, and MRI. Okay? The other approach is to take the drug tamoxifen, which we know works from the breast cancer prevention trial that was done, the P1 trial. And then the final approach, or other approach, is what we call risk-reducing surgery, which is a bilateral total mastectomy. So those are the discussions. That's the discussion we have with those individuals. I don't push them to either one. We make sure that we take the time to explain each one and let them decide what they are most comfortable with. But stressing that you need to have some plan for follow-up in some way. That's how we approach it.